Hello, my name is Beth Gill. I'm the director of the Nursing Assistant Program at Olympic College. Thank you for joining me today for this virtual information session and for allowing me the opportunity to tell you about a program that I'm very proud to be part of. While you're viewing this presentation, I hope that you'll jot down any questions you might have, as well as register for one of our upcoming advising and information sessions. I'll be able to answer all of your questions at that time. I want to again thank you for joining me, and I also want to tell you that the faculty and I look forward to having you as a student in our classes, and we want to be a partner with you as you join us in this rewarding career of nursing. During this session, we'll go over some important information that can be found on our program overview webpage. We'll talk about what a nursing assistant is, the courses that are required to take in this program, some resources available for you for student success as well as for paying for the program. I'll talk about the supplies and textbooks that are needed for our courses, how to get registered and started at the college, and what documentation kinds of things are needed in order to attend the clinical practicum course. I'll also let you know about getting registered with the state in order to become a nursing assistant registered and begin work, and what competency testing will look like when you've completed our program. So please remember to take notes, to jot down any questions, and to join me at one of our in-person online advising and information sessions. At the bottom of our Nursing Assistant Program overview page on the OC website, you'll find a number of useful documents. You'll find the information session slides that I'm using in today's presentation, calendars for upcoming quarters that are subject to change. You'll find a copy of the Nursing Assistant Program Clinical Passport, which will help you gather your information needed in order to provide the proper documentation to be able to go to clinical. And you'll also find a summary of the costs for the Nursing Assistant Program. In addition, there is a tab for advising and information sessions that if you go to that, you'll be able to sign up for one of our in-person Zoom sessions so that you can have all of your questions answered. Since I'm an educator as well as a nurse, I have to start out with a little bit of teaching. So let me ask you, what is a nursing assistant? Well, hopefully you looked at the title there and you said, well, of course, it's someone who assists a nurse. And of course, you are correct. A nursing assistant also assists their patients or clients or residents, and we call them different things depending on where we are caring for them. You perform your duties under the direction and supervision of a licensed nurse, whether that be a registered nurse, an RN, or a licensed practical nurse, an LPN. And you can work in a variety of settings. You can work in acute care, which is hospital setting. You can work in skilled nursing, which might be a subacute place like a rehab facility or a nursing home. You might find yourself working in assisted living, which is an apartment living with nursing care. You may choose to work in an adult family home, which has up to 6 residents, and the nursing assistant performs other duties besides just the nursing care. They might help with housekeeping, feeding their residents, making meals, and other sorts of things. Or you might find yourself working in home care, where maybe you're taking your client out to a Rainiers game, when we can go back to a Rainiers game, to the grocery store, or to their medical appointments, as well as helping them with their activities of daily living where they live in their house. So essentially, as a nursing assistant, the field is wide open and flexible. You can choose where you want to work, and I'll tell you, the employers are lining up waiting for you. You are entering our program at a very interesting time. Due to coronavirus, most educational institutions, and Olympic College is no different, are going to an online format for the majority of their programs. Our program is as well for our lecture course. Our Nursing Assistant 105 course is going to be delivered online for the first 5 weeks of the quarter, front-loading the information and being offered via Zoom and Canvas. Our lab and our practicum courses, however, are allowed to be on campus, in person, and at clinical sites because nursing assistant students are considered essential workers. We'll be providing appropriate PPE, personal protective equipment, to keep you safe while you're providing care for your classmates in the lab setting and your patients or residents at the facilities. So our NA 105 course is I say it's the meat and potatoes of our program. It's where we go over all of the overview of the nursing assistant program and what the requirements are for you in order to complete the courses and to successfully obtain your certification at the state. We cover what the role is as a nursing assistant, orient you to your role as a member of the healthcare team. We cover HIV, AIDS, and bloodborne pathogens training that is required for all healthcare providers in Washington State. We talk about all of the body systems and their structure and function. We talk about them as far as how they relate to the elderly and aging related changes and things that you as a nursing assistant will need to look for to keep your clients healthy or to improve their health if they are having some disorders. We'll cover basic principles of nutrition, as well as dementia care, mental health care, and end-of-life care. As often as we can, we try to have guest speakers join us in the classroom, and they will be joining us online in the classroom this quarter as well. As I mentioned, nursing assistant students are essential workers, and as such, you will be able to come to our campus for the Nursing Assistant 115 class, your Nursing Assistant Lab. In this class, you'll be practicing all of the skills that are necessary in order to get a job as a nursing assistant and to pass your state exam. They'll include all of the basic technical skills like vital signs and infection control. You'll be doing CPR class and getting your BLS for healthcare providers professional level CPR certification. You'll be practicing most of these skills on each other, but some of them will be done on a mannequin. You'll be provided with appropriate PPE, gowns, masks, and face shields, as well as gloves, to do your skills on each other and to remain safe from the COVID virus. Once we've completed our nursing assistant lab, we're going to be ready to hit the road and go to the clinical facilities to complete our practicum course. So as I mentioned, typically we do 64 hours of clinical in the facility. Due to the COVID-19, we might decrease those hours to the minimum required by the state at the facility, but complete the remainder of the hours in the lab. That's something that we are still working on, and it again will depend on the social distancing requirements and the safety and health of everyone in the program. At the end of the program, you'll notice on week 9 and maybe 10, depending on whether you're in Shelton or Bremerton, that we come back to the lab for 2 8-hour shifts. We complete an employer panel and mock interviews where we invite employers from the community to come and let you ask them questions about employment, as well as interview you to give you practice. Now, a lot of those mock interviews turn into real job offers. As I mentioned, you are highly desired as employees in the community, and our area agencies that we work with are very excited to have you come on board with them. The last thing you'll notice on your calendar is that we have final skills testing for the last part of our NA 120 course. All of the students in the program will demonstrate in a mock state test sort of situation their testing, their skills, their competencies with me, the director of the nursing assistant program. This ensures that you have what it takes, that we put our stamp of approval on you, and that you are ready and raring to go to take your state exam and become a certified nursing assistant. Olympic College has a number of resources to help with our students' success. One of them is integrated right into our nursing assistant program in the IBEST, or Integrated Basic Education and Skills Training model of team teaching. In your class, you will not only have a nursing assistant instructor who is a registered nurse and a subject matter expert as far as the nursing content goes, but you will also have a basic studies instructor who is a subject matter expert on things like helping you write your essays or using the technology we'll be utilizing in our course, or doing the math that you need to do in order to work as a nursing assistant, or writing your resumes and cover letters. You will find their help invaluable. And as I said, they'll both be in the classroom with you, so it'll be 2 for the price of 1. Even when we're not teaching an online course, we use technology in our courses. We use Canvas, as I mentioned, and we're also using Zoom. So if you've never used Canvas as a student, there is a free Orientation to Canvas for Students course that you can enroll in at the college. It's General Studies 097. In addition, there are a number of loaner laptops available through Information Technology. Their phone number is listed here. We also have a number of computer labs available on all campuses, and depending on the restrictions related to social distancing, the hope is that we will be able to open those computer labs up with proper disinfection and social distancing so that students who need that environment, maybe don't have the correct computing at home, will be able to come to campus and get the help they need here, as well as having those techs available in the computer lab for problems you might be having. If you've ever had or needed an accommodation for your education, we would encourage you to contact Access Services to supply them with the documentation that will allow you to have accommodations in our class. We've had a number of students in the past that have had things like extended testing time, a quiet test environment, that were able to have computerized readers for them, that were able to record the audio or the lectures that are being given to listen to later, or that have had some physical items that were needed to be taken care of in our lab course. For instance, we had a person who was not able to feel pulses with their fingertips because of some nerve damage. So their accommodation was to be able to listen to a pulse with their, to the heart rate to get their pulse with a stethoscope instead. We've also had students that have had some hearing deficit that Access Services was able to provide an amplified stethoscope for them to take blood pressures. We cannot accommodate any special needs or requests in our classroom or testing situation unless a student has gone through the Access Services route. So please contact them sooner rather than later. We want you to have all of the services that will help with your success in the classroom. We also have an English to Speakers of Other Languages department at our college. I've given you the contact information here for our Bremerton office, but we do have support in our Shelton campus as well. If you think that you might need some more assistance with speaking the English language or reading the English language prior to joining our course, the Basic Studies folks that teach in this program would be able to help you with that. There are a number of sources available through the college and in the community to help pay for the tuition fees and related expenses for the nursing assistant program. The first on this slide is Worker Retraining. You can contact them through our website or the numbers I've located here in order to apply for the eligibility for that program. Essentially, most nursing assistant students do qualify for funding under this payer source. Because nursing assistants require specific training in order to get a job as a nursing assistant, you generally automatically qualify for Worker Retraining. BFET, Work First, and Opportunity Grant all have income eligibilities. BFET is for folks who are receiving SNAP benefits or qualify for SNAP benefits, which is assistance with food. Work First is based on income eligibility as well, and they're able to help out with some things, not just tuition and fees, but sometimes childcare and transportation and such things such as that. Opportunity Grant is for students in professional technical programs like the nursing assistant program, and they provide tuition and fees assistance and some books and supplies as well for their covered students. If you're in the military or a veteran of the military, or maybe you're a family member of military or veteran personnel, you might be eligible for some help through the Military and Veterans Program. So I encourage you to contact the MVP program at the information I've given you here, or to look for their link on our website and talk to them about what they might be able to help with. If you do end up paying out of pocket, you can set up a tuition payment plan at our cashier's office. And I believe you're able to do this online through your process as a student when you're scheduling your courses. And then finally, there are some community sources available through WorkSource of Kitsap or Mason County. They have a Workforce Innovation and Opportunity Act that is also there for folks who qualify because they don't have a job, they're unemployed, they need to, they're a displaced homemaker or something like that. So I'd encourage you to contact WorkSource directly for information about those programs and to apply. And then if you are paying out of pocket, or if you pay out of pocket for any pieces of your tuition, fees, or supplies, please save your receipts. There is a nursing assistant reimbursement program that is for our skilled nursing facilities, like nursing homes, that receive funding from the government through Medicaid reimbursement. So if you have any out-of-pocket expenses, the law says that those skilled nursing facilities must provide for you a reimbursement. They don't have to do it until you've completed your state exam and passed it, and they could take up to a year to do it, but they can and should and are actually legally bound to reimburse you for your expenses related to your education. On this slide, you'll see the tuition and fees related to the current academic year as published on our Olympic College website. You'll also find the fee for our Nursing Assistant Lab 115, as well as the approximate cost of supplies required for our program. You see the safety documentation information here, which for the record is not included in the reimbursement program I spoke of prior. You do need liability and malpractice insurance that you can purchase through the OC cashier, through the website, or in person when that's available. And you'll also need to have a copy of your personal health insurance. If you don't have personal health insurance, there is a 1/4 student-only plan available through forstudenthealth.com that costs $39. It is only for catastrophic or injury and only plan. It is there for you when you're in the practicum setting because you won't be covered under typical labor and industry laws. You aren't an employee of the facility. And then also located here is the cost of the nursing assistant state exam, which will be $124 payable after successful completion of the program. So all told, the cost of the educational expenses are about $1,850 for our program. Most of these are covered under some of the payer funding sources that I showed you on a previous slide, and all except for that safety documentation are subject to reimbursement through the Nursing Assistant Reimbursement Program. We have 2 textbooks that we require for our program. The first one is the 5th edition of the Lippincott textbook for nursing assistants. If you were to purchase it new, it would cost $77 at the Olympic College Barnes & Noble bookstore, and you will need it for readings on the first day of class. The bookstore is able to mail with, I believe shipping is free to your home if that's where you get your book. You're not required to buy it through our bookstore. You can buy it from any online retailer like Amazon or barnesandnoble.com or anywhere you can find it. Although the bookstore may have some used or rentable versions available as well. You'll also notice that there's an ebook version available for that textbook if you prefer to use an e-reader. The other textbook we require is the BLS for Life Support by American Heart Association. It costs under $20 new at the bookstore as well. You're probably not going to find that one used, but you might find it somewhere on the web a little different price, or about the same probably. You will not need that until we come back to campus week 6, but we will use it that first day of week 6. We have 2 other textbooks we like to mention and recommend, but they are optional, so they would not be covered by any of the funding sources, most likely. There's a workbook that accompanies the Lippincott textbook that we use. We do not use this workbook in class, but a number of our students have told us that they recommend it as a study tool. We do post the answers to the workbook online through your Canvas course, so you will be able to check your work. We also recommend this dictionary. It's the Longman's Handy Learner's Dictionary of American English. You can use that on any of our exams in class as well as the state exam. And it doesn't matter whether you use the Handy Learner's version or the larger version. The difference is the price and the size of the book, but it doesn't matter what edition you use for that either. Other items we need when we come back to the lab, week 6 or whenever that is, you'll need to have burgundy colored uniform, top and bottom. Most of our students get it through our bookstore or at Walmart actually has the same wine color, I think they call it, but they have a pretty decent uniform available there. Before we go to clinical practicum, you will need white shoes or mostly white shoes, and they don't have to be nursing shoes. They can be tennis shoes.
Let's say they were a pair of white Nikes with a blue swoosh, that would be fine. We'd allow that. You'll need a stethoscope to practice blood pressures. You'll need a watch with a second hand to practice pulse and respirations, and to time the amount of time it takes to wash your hands. I'm sure you guys are all doing 20 seconds now. And then you'll also need a gait belt or transfer belt, and you'll need that when we go to the facility. I would recommend possibly waiting on that purchase unless it's being covered by funding, because there may be some restrictions on whether you can bring your own materials into the facility to use on clients, or whether you'd even want to. If you do have a gait belt that you bring into the facility, we would recommend you washing it between the days that you are there. Most likely there's going to be restrictions on using your own gait belt or equipment in the facility.
You can get started in the Nursing Assistant Program at Olympic College by going to the Olympic College homepage at www.olympic.edu. You can drop down on the Getting Started menu and find how to apply online to the college. You'll be able to set up your account, get a identification number, and be able to then go in through the Student Self-Service button at the top of the page and register for the 3 classes in our program, NA 105, NA 115, and NA 120. Please note the correct campus that you want to attend under location. By contract with Olympic College, all students participating in patient care experiences must meet a number of health and safety requirements. At the bottom of the Nursing Assistant Program Overview page, you'll find a Clinical Documentation FAQ, Frequently Asked Questions tab. And in that tab will be a copy of the clinical passport requirements, as well as a video to explain all of the documentation requirements you'll need in order to attend NA 120. These clinical passport requirements are due in Canvas 3 weeks before the start of your NA 120 course. Instructions for uploading documentation will be available in Canvas in a separate course from those you are enrolled in for our program the week prior to the start of the quarter. As early as the second week of the quarter, nursing assistant students are eligible to become an NAR, or a nursing assistant registered. This is a credential that's required in order for you to work in long-term care. Most people go to work in nursing homes, which are also called skilled nursing facilities. It is an $85 fee that is payable to the Department of Health when you apply, and we will have an application link in your Nursing Assistant 115 course when the time comes. There is a rule that says that NARs must pass their state exam within 4 months of hire in order to remain employed in skilled nursing facilities. However, during this COVID-19 crisis, there has been a waiver in place to extend that 4 months because testing is not currently happening. Now, when testing does reoccur or get reinstated, I expect that that waiver will go away, or at the moment I expect it to be extended. I'll keep you updated when I know more. After you've completed the program, you're eligible for a few things. You'll be able to get your certificate of completion that says that you have completed the DSHS DOH training program at Olympic College. You'll also receive an Olympic College Certificate of Recognition. That is a $10 fee to apply for that certificate. It's kind of like applying for graduation, but a number of the payers that fund your tuition and fees will also cover this certificate. You'll be eligible to take the state examination. It's $124 that's payable to an outside vendor, Pearson VUE. You'll be eligible to apply to become a nursing assistant certified once you've passed your state exam. That'll be another $85 to the Department of Health. They really like our money. And in addition, if you're considering going on in nursing, you'll receive a factor point toward your application for the LPN program here at Olympic College. In addition, once you become certified, you'll become eligible to test out of 2 courses in the first quarter of the program, which will save you some time as well as some tuition money. Well, we've come to the end of this presentation. I have my phone number and email here if you want to contact me for further information. But the best way to find out the answers to all of your questions is to join me in our Zoom room, and that will be for our advising and information sessions that you'll find through the link on our web page.
You'll be able to register for any or more than one of those sessions if you want, and join me so that we can meet. I can go over a few more things like the calendar for the next quarter and answer those questions you might have. Thank you for being with me today. I look forward to meeting you in person soon on Zoom.